So a lot of people want to have a little bit of volume in their lips. So some people will come in and say, I just want to get a lip flip. So a lip flip is a procedure that we do when we're injecting a little bit of toxin into the upper lip. So generally it's a few units of toxin, Botox, Dysport, Xeomin, in that upper lip, right on that little border of the lip line. So we generally will do anywhere between 4 up to 12 or 14 units in that area, depending on what we're trying to achieve. With that, it'll usually only last about 4 to 6 weeks, and it will just turn that lip up a little bit. However, we also have something we call a signature lip flip here at Zona Med Spa. That will consist of a little bit of filler into the lip along with the toxin. So what that does, it's going to give you a little bit of volume in that lip, turn the lip up, and that generally will last you about 3 to 4 months. Then if we say, you might not be a candidate for the lip flip, and maybe you just need volume in your lip, that's when we would decide to just strictly use a filler. And so if you do a filler, lip fillers generally will last you about 6 months. Some people, give or take, if they exercise a lot, it may not last as long. And some people, it will last longer, depending on the person. Product-wise, depends on what the goal of the person is, what their lips look like. Are their lips very thin? Are they very stretchy, where they've lost a lot of the collagen? Are they crepey looking? So a younger person may be fine with just using a Versa or a Juvederm, or even Restylane for that matter. We here prefer Versa because there's less swelling with Versa, so that's what I prefer to use here in my practice. Usually it's about $600 per syringe. If you're doing the signature lip flip, we charge $350. If you're just doing a Botox lip flip, we charge $199. We're very straightforward about pricing here. There's no secrets. It's all right there, out there. We tell you the price of your product before you even do treatment, so there's no surprises at checkout. If you're doing lip filler, say you are an older woman, you're in your 50s, you've never done anything before, you've lost collagen, elastin, your lips are a little crepey, we may recommend 2 products. I may recommend a Restylane Kiss to help with the hydration, and then I may do another product to help with volume. And the product I use will determine on what your goals and outcomes are. Everyone thinks that a half a syringe is a lot. Some people think a full syringe is exceptionally a lot, but I'm here to tell you, it takes a lot of filler to get that overdone look. So when you come in, we don't do the overdone look. So if you're looking for that overdone look, we're probably not the right practice for you. But if you're wanting a natural, voluptuous look that looks natural but full, we're the right person for you. We don't want your lips to get filler migration, which is a big buzzword right now. So filler migration happens when you get overfilled, when you are doing other things that you should not be doing with your lips with lip filler that can cause the migration. If you do get migration, the nice thing is we can always dissolve it, but there's a cost to dissolving. And so to dissolve your lips will generally cost you as much as it is to do your lips. So that's why it's important to go to a good injector that knows what they're doing so that you don't get that migration and that you trust to give you the result that you want so that you don't have that migration. And some people naturally are just gonna have that migration because they've lost so much collagen and elastin in their upper lip that filler is gonna wanna go there anyway. So that's where we would come in and do a consult and do what's gonna fit best for you so that you get the result that you want.